Hello, everyone. Welcome back to another episode of Honey Sundays. I am so thankful to have you here. Today's episode is very raw, very candid, and just very funny. I am joined by Woody Alpern, who is a really good family friend. He is an expert scuba diver, an entrepreneur, and honestly, just one of those people that has a super interesting life. He's the CEO of Southeast Swim School Holdings and the co founder of Dive Talk, which is a podcast and a YouTube channel that is all things scuba diving. So he has a crazy background, but today's conversation between us, we actually got cut off, and there's two different conversations. And today's snippet of it is where we actually don't really talk about scuba diving and his background much. We talk more about health, nutrition. He's worked with me, just modern medicine. We go down all the rabbit holes, all the tangents, and then just have this very open and honest conversation about all the things that some people might steer clear of. I can't wait for you guys to hear it. So let's get into it.
I mean, we are medicating you as the mother when you're giving
Yes.
birth. It's definitely got to go into the baby. But I know this is going to sound bad, but that's what I do on YouTube.
Yeah.
Okay, so what? It's
Mm.
not, is it hurting the baby? Is there any proof?
That's a great question.
Why not be comfortable if it's not hurting the baby or you? Or is
True.
it?
Well, okay, so to give context too for people listening, Woody and I got cut off in our previous podcast. I'll probably make an intro for this. But now he's talking to me. I am 25 weeks pregnant for those that don't know. And now he's asking me about my first birth, which was a home birth, all natural, no epidural in a home birth. And I'm planning on doing the same with this one. And I do want to say that too I think birth, just like anything else, like I'm taking it with an open hand of if I have to transfer, of course I will. But as of right now, I'm planning on unmedicated home birth like I did with my first. But he was asking if an epidural and the medications, maybe they cross to the blood-brain barrier to the baby, but do we know that? And is there an effect on that?
Exactly.
My big thing that I've learned, and from my personal experience, is when you get an epidural, you are numb from, basically waist down and belly down. And the data shows that there is like a 40% increase of odds of having a C-section after you get an epidural. And that's because women will stop progressing. It's multiple reasons.
My daughter did end up having a C-section.
You usually
I didn't add that.
after the epidural, always. Because what it's doing is our body already, and this all goes back to like faith too, but our body was designed, when you look at the hormone cascade in general for women of even how we get pregnant, but then in birth, there's a hormone cascade too of different hormones are triggered at different points in labor. And the contractions, this is just back to anatomy 101, but the uterus is a muscle. So what the baby's in and every contraction is pushing the baby down. It's like us flexing our bicep, like we're trying to crush an egg or something, right? And obviously you dilate, all these things happen. Like there's so many things that happen when the innate intelligence, it's crazy. But there is a much higher chance. And in my opinion, when you were severing that body-mind connection with an epidural, with numbing, then you don't know. For example, my sister has 4 kids and she's gotten an epidural with every single one of them. And every single one of them has been different. She has 2 girls, 2 boys. My first niece, she felt like it wore off by the time it came to push. My nephew, she was like, I don't even know what's happening. It was like a disassociated feeling. She didn't know when he was coming or anything. They were prepping her for a C-section because she wasn't progressing. And then literally at the last second before they were about to wheel her back, his head popped out. And so then they didn't have to do a C-section. And then my last niece, I forget if this one she was either super numb or like not numbed at all because it just changes.
But what's the issue with having a C-section? I know you're being cut as the woman, so there's that, but
yeah. I mean, I haven't personally experienced a C-section to talk from firsthand, but there's a lot. I mean, they're cutting through 7 layers of tissue, first of all. And I think my big thing with that is like, just like anything, are we intervening too soon sometimes with a C-section? Sometimes it's, of course, medically necessary. But at the same time, did we give the mom enough time to, labor. I mean, money, they want to turn those beds
Well,
quick
it's
in the hospital.
yes.
So, and a C-section is $20,000 more than a vaginal birth because you're getting an anesthesiologist that has to sit in there. An anesthesiologist with an epidural, they come in, they're in there for 10 minutes and then they're out.
Yeah, that's very
So
valid.
so then you think about following the money and you're like, why has there been such an uptick in C-sections in the last 50 years? And I think also just the healing. I mean, it's really hard. Again, this is not personal experience, but I have a really good friend of mine. She's got 3 kids. First one, her oldest is 4. One, she tried to have a home birth. She ended up transferring to the hospital, but had her naturally. So no epidural. Second was a home birth. And then third, she wanted a home birth, but ended up transferring and having a C-section. And she just talks about her experience, you know, the C-section recovery was really hard and really different because basically your abs are severed. So even getting up and holding baby is different. And yeah, there's just a lot of other things. Like for her, it was really hard, not to share too much, but like she did push and then they took her to a C-section. So it's like she was kind of recovering from both, which is so hard. But yeah, I agree with you. When it comes to birth, if anyone's listening to this for birth advice, my biggest recommendation is do what you feel is safest because that's the easiest birth. When we think about animals having a child, they usually go, to the back to the field or they tuck away in their den. They go somewhere
Mhm.
calm and quiet and private. And everyone has a different depiction of what that looks like. And I will say, if you are high stress, even at home, then your birth is going to be hard just because it's our nervous system. And are we letting the hormones take over or is cortisol driving us and being like, it is not safe to have this baby right now?
Well, as a man, I obviously will never know this. So
Yeah.
I'm going to ask you, I'm just curious. I bet a lot of people are of this question.
Mm-hmm.
Natural childbirth,
Yeah.
would you say it's the most excruciating pain you've ever felt? And if it was, what was it the whole time? Or did it finally, like the body, do
Mm.
anything natural at some point where it took over because maybe 300 years ago, that's how everybody was having a
Yeah.
baby? And do you think there's any higher risk associated with that? I mean, is there a higher chance of complications if you do a natural?
I
I wonder because I mean,
yeah.
there used to be
Yeah.
hundreds of years ago, a lot of
For sure.
mothers and babies didn't survive. Why are they all
Yeah.
surviving so much more now? So
Yeah.
those 2 questions.
Okay.
I'm
First,
curious.
yes, it was definitely the hardest thing I've ever done. However,
I'm so glad you're honest.
yeah, of course.
That's good.
Because here's what I'll say. It's so hard to describe until you go through it, but it's a different kind of pain. It's not like, and also the going back to the innate intelligence, you have a contraction. That's the squeeze. That's what's painful. But then the body rests for like 3 minutes. That's where contractions
And
are.
during the rest, is it not
During
painful?
the rest, there's nothing. You're still like, you're kind of coming down from the wave. It's literally, the wave is the best way to describe it. It kind of goes up and then it goes down. Then it goes up, then it goes down, but your body rests in between. And I think that's just also such a cool design. When you get on drugs, for example, Pitocin, which is
Yeah.
it stimulates the uterus to make it contract, there's no breaks in Pitocin in terms of contractions. I have heard that's a thing I learned in nursing school. That's a thing I've heard from many people that their contractions were so much worse with Pitocin because they're not really getting that natural break. It's just like the body's constantly squeezing because it's a med, it's an outsider, you know?
So when you say it's the worst pain you ever felt,
Mm,
is it like you're screaming and crying and holding
No,
on for help? Like I'm in agony?
no, it's not like the
Okay.
movies. That's
Okay.
that's a big
That's
thing
what I
too.
thought.
Yeah,
That's why
right.
I'm asking.
You have to like undo. It's kind of crazy. That was a big part of my prep for my first is I was, what you see in the movies is someone's like screaming.
Yeah.
So there's parts obviously as you get towards the end. And I have to say too, every woman's experience if you've had a baby is different. Where, some people like I was relieved when I got to the pushing part because I could actually do something. And I think mentally I'm like, okay, she's right here. Like she's right here. But I will say there is this protective what they would say is you go to labor land. And it's almost like the hormones and everything, you're still there, you're still feeling it, but it's almost like, I don't know, God's protection of like, you know what? We're just going to our mind is a little bit over here and you're just so focused on what you're doing. And I would say, yeah, it's not consistent in terms of, and the relief after you have them and like
That's what I was going to ask you. I'm
yeah,
not kidding you.
yeah.
I was just going to say, so once the baby is out, is it
Mhm. Oh,
immediately
yeah,
all
immediately
pain's gone?
done. Yeah, and oxytocin rush, the happy hormone of when you see your child. I will say, like, going back to Laborland, like, I will say when they put her on my chest, I was like, "What just happened? Like, what did I do?"
Oh,
I have never done mushrooms or anything, but I would say it's probably similar to that where you're, like, coming back down to earth, you know? But it is also the coolest, proudest moment of my life, regardless of, and I don't
nice.
even think that should be natural. I think that's regardless of any woman having a child is, that's the greatest gift you could ever get, a healthy baby put on your chest, you know?
How about was your husband right next to you during the birth?
Mhm.
And was he saying, do whatever you want, or I prefer you to do now? Did he have a
So,
bias?
yeah, so that's a great question, and I think a lot of
And why?
couples
If he did have a
yeah,
bias, I'd be curious of why.
I think a lot of couples do this is also so funny, I feel like you're interviewing me, which is great. Woody and I are just gonna go
I'm
back and forth,
honestly just,
everyone.
I'm really honestly curious.
Yeah, I love it. I love it.
This is how I am on YouTube,
Yeah,
because I bet you there's a lot of women and men
yeah,
wondering,
yeah,
right? A man, from my man's perspective, I mean, I'm sure there's husbands like that
totally,
have a bias, and is it okay? Do I talk to my wife about it?
for sure.
Here's what my bias is. Is that even fair to impose that?
Mhm.
Like, as a
Yeah,
man, they
yeah.
got to be wondering that. That's why I'm asking.
Totally. No, that's a great
Pretty interesting,
it's a
actually.
it's a great question. So my husband is very data driven. He's very left-brained. He really likes to know the facts. So I will say when we were deciding what to do, because I didn't get pregnant and I was like, "Oh, I'm having a home birth." I explored all options. Granted, I am a nurse, so my background, I was like, I don't really want the hospital. I would like to try for a natural birth. So we visited a birth center, which is basically an in between where, you know, you go in and but they don't have it's basically what we found is after touring the birth center, after starting our care there, that a home birth and a birth center are essentially the same, except a birth center, you're going to a hotel room with a tub and a bed rather than your own bathroom in your own house. You're still having a midwife. They have no anesthesiologist, so there's no option for epidural.
So you might as well just
E
stay home in a way.
exactly, and that was what our finding was. So
Okay.
after touring that, my husband was like, "Okay." And no, he was amazing. I really could not have done it without him. His take on it now is, I think, just trusting, what we had to do, but with the open hand. I really can't recommend that enough as a husband and as the woman that's gonna have the child is the best line I was ever told when I was pregnant with my first, it was from my midwife, and she said, "It's not just your birth, it's the baby's birth." And that was really good because they have a say, whether you believe this or not, I guess, but I believe it. They have a say of how they're coming into this world, how
Wow.
fast it is,
That's unbelievable.
they're
That's really cool perspective.
I think it gave me, as the mom, some pressure off. I'm like, you know what? Same with due date. She's going to arrive whenever she's supposed to arrive. She was 10 days late. She was going to arrive whenever she's supposed to arrive. And it's going to be all in her time. The body knows, the baby knows. I mean, think about the baby coming through the birth canal. They flip head down majority of the time. Some are breech, but they know exactly the positioning to enter into this world. Like, it is really crazy to think about,
Amazing.
just like the innate pattern. So we did a lot of research beforehand. And again, like I said, if my midwife said we need to transfer you, I would say, okay, and if I had to get a C-section, well, the goal should be the same, whether you're getting medicated or not, is to have that healthy baby and for you to be healthy.
So your husband basically analyzed through some kind of data research he did on his own. And then after that analysis, this is
Mhm.
what I'm trying to get you to tell me.
Yeah.
What did he say to you?
Oh,
After he said the
should
dead,
we call him? He would say,
yes, like, what did he say? He said, "Hey,
he
I
said,
want you
he said,
to."
I'm on board. After we toured the birth center, I think that was his big, like, okay, this is no different. And Andy doesn't want to, she wouldn't feel comfortable going into a hospital. So it's not that I wouldn't feel comfortable. It's that the other piece of it is mindset. And when you don't want a medicated childbirth, and when you're in the middle of a contraction and someone's saying, "Hey, You want some drugs to numb you? It's so hard. That would probably be so hard. Of course you'd say yes.
Yes, I would think.
Yeah. And also the in and outs, and going to a hospital has its cons too of, will your provider be there? What nurse will you have? People are shifting in and out. And I will say personally, I'm a very private person. So I wanted to be as prepared for this scenario as I could in terms of like controlling what I can, controlling the environment. Again, unless I needed to change it, controlling who was there. It was my midwife, her student who I'd met several times, and then a doula and my husband. And that was it. It was private. It was like the nature, like the lights were off. I was like very just in my own comfort zone. And I think that's so important.
It's awesome.
Yeah.
But I don't know if everybody could say, I'm willing to tolerate the pain because I feel like there's some data or something out there that is ultimately going to tell me this is actually better for the baby. Is it better for the baby? Is there any evidence whatsoever?
A natural childbirth?
A natural childbirth versus having an epidural and giving childbirth.
So in my opinion, yes, it's better for the baby.
But is there anything backing that up other than your opinion?
Yeah, I'll tell you why.
Okay.
So I think that if you watch births, same with your girls. Think about, so Woody has 2 girls to give context, and he's now a grandpa. But they take the baby from mom. The first person to touch the baby is the doctor. And then they towel them off really rough. They're under these LED lights. It's fluorescent as can be in there. Mom is, someone's manhandling mom over there too. And then they give you the baby. And this is kind of old, but I was spanked. My mom has told me this when I came out because they want them to cry. They're stimulating them. And that's where the towel rub comes into. They're really trying to stimulate the baby to make them cry. But I just think about what a entrance to earth. Like picture you walking into a room, someone smacking your butt and like rubbing you aggressively. And it's not your mom right away. And then they're giving you to your mom. And I do think about that just as a nervous system approach of they put my daughter on my chest. And you don't want the baby to get
cold. So in your case, just to back the difference, I want them to understand the difference.
Yeah.
The aggressive, wrap them up, spank them, whatever.
Yeah.
You're not the first person to touch them. I would say, I don't know what % of the world is doing that, but it's the vast majority.
Yeah.
Versus baby comes out naturally. What happens at that exact moment right after that?
Yeah. So my midwife handed her to me like within 0.1 second. Depends on what position you are.
Not wrapped in a towel or anything.
No, naked. I actually thought I was going to drop her. That was my first thought. I was like, oh my gosh, am I going to drop my baby? But I didn't. And then, put her on my chest. And then, of course, you don't want the baby. The baby is wet, obviously. Yeah. And so you do put a blanket or a towel on her, but lightly. And then they start, they'll start crying or whining on your chest, but not with any, usually you don't need that stimulation. And my room was dim. Again, we didn't have to leave.
But they already cut.
No, so still attached.
Literally attached to you on your chest immediately.
Yeah. So this is a whole other thing. So let's get into this.
They're going to think my questions are so naive and dumb, but I'm telling you, most people don't know.
Oh yeah.
I bet you the majority of people do not know.
For sure.
This.
No, these are all excellent questions. These are all questions I had when I was pregnant and I'm a woman because no one teaches you about this stuff. But one thing that's very common now is delayed cord clamping. And the definition of delayed cord clamping is 3 to 5 minutes because I'll tell you why legally. The second that cord is cut, the doctor can leave the room. So because you become 2 different patients. So the doctors in the hospital want to cut that cord ASAP because they want to get out of there. The money is paid and they are done. They don't legally need to wait for anything. However, it takes 10 to 15 minutes. Don't quote me on this. It might be a little bit longer for the placenta to fully, in the umbilical cord, to fully drain into the baby. That being said, once a baby is born, over a third of the blood is still in the umbilical cord.
When are they considered born?
Right after passing the
The second they're out of you, they're born.
Yes, even if they're still.
That's the time. Boom, they're out of you all the way, born.
Yep. And then some people will snip that umbilical cord in a minute. However, this is the thing. There's 33% of a third of their blood volume, baby's blood volume, is still in that cord. Because think about while they're in utero.
That's what you mean by that's what's draining back into them.
Yes.
Blood.
Is blood, nutrients. And so then we're cutting, and then, some of these
That's really interesting.
That's a scientific fact. That's not my opinion. That is, you can look this up. And so that's where the delayed cord clamping, even if you're waiting, usually it's supposed to be 5 minutes, but most doctors will not wait 5 minutes. They'll wait like 3. And it's like, how much of that blood did that baby get? So now they're coming in, blood deficient, as if they just got a blood draw for no reason. And it's all money of why they cut it so fast. So that's just another reason of like, we intervene. My whole thought process is that we intervene way too early in pretty much every single situation. Same with cholesterol. If your cholesterol is high, what we're going to do is we're going to put you on a statin. We're not going to tell you about your diet changes. We're not going to tell you to walk more. We're not going to tell you to lose 15 pounds. It's going to be, some doctors do, thankfully, but majority is, here's a drug and here's my paycheck from it. And it's really frustrating because they don't share these statistics. They don't share, once you get an epidural, here's this, and this. They don't share. It's scary. I remember being, shadowing an OB. I never worked in OB, but shadowing. And as much as it was fascinating, it was also really scary of just different scenarios and how much we do to the mom, and we don't even question it.
I know. I'm going to ask questions that are just in my head because I
so
wonder,
funny.
based upon that philosophy that you just said, in my mind, when do you believe it's time to intervene with what science would say is science? They're going to say, Andy, I know you're saying all this natural stuff, but like we have modern medicine now. Your baby, let's take that as an example, is sick in some form, whatever that sickness may be. And we have medicine for that. When are you going to say, being of your mindset, which is more natural, natural healing, natural everything?
Yeah.
When do you say, no, it's time to intervene with something more? I'm letting go of this natural because I could be endangering
risk. Right.
my baby.
I think that's a great question. I think every scenario is different because, for example, what comes to mind is a fever. And when a baby has a fever, okay, my daughter's almost 2, she's 20 months. And she had a fever probably about a month ago. But what our thought process is, I think as a majority in culture, is fever, Tylenol. 99.9, you take Tylenol. But the fever is our body's natural mechanism. The body heats up to burn off the virus. That is exactly why it's heating up. That is the physiology of what is happening, is that the body is heating up for us to sweat. And once you break the fever, you sweat to detox, but you're literally killing the bacteria in the virus. That's what's happening. So when we don't give the body a chance to do that, it's like we're intervening. One, Tylenol, another facts, is it tanks glutathione. Glutathione is our number 1 antioxidant in our bodies, and Tylenol absolutely tanks it. So you're taking this medication and then you're getting rid of your antioxidant at the same time.
There's no way I can't imagine they would have taught you this in nursing school.
No.
Because if they teach you this in nursing school, it's sort of the opposite of being a nurse, where doctors and nurses are about medicine. Don't do more harm, but use medicine. We have medicines that could do certain things. So, I don't know how anybody would figure this out.
No.
But you still have an answer.
Yeah.
I'm going to make you answer when
I'll
you would
answer.
interview. But keep
so
going.
For my daughter, for example, and again, this is to each individual when they're comfortable with it. But my daughter got up to like 101.7. And, I was caught. Keep in mind, I am a nurse too. But other than that, she was drinking fluids. She was acting normal. I mean, obviously she was sad and not feeling her best, but like she was laying with me. She was drinking fluids. Like there was no other signs. So I didn't give her Tylenol because I was waiting for it to get a little bit higher because I knew that this was her body's natural process. Another thing you can do when your child has, just for a side note, is put them in a lukewarm bath. That can be really comforting. It can take the fever down naturally without Tylenol. However, if she got up to like 102.5, around there, I would have definitely thought
that was your threshold.
Yeah, that was my personal threshold.
And why 102.5?
That's just what I would feel. I would call my pediatrician, and ask her thoughts. But for me personally, that's where it starts getting a little bit. I start getting a little bit uneasy. However, the majority is, 100.2, which is Tylenol, Tylenol, Tylenol. And then we just give it to kids every 4 hours. And then we're depleting those natural helpers.
Okay, don't shoot me for asking you then this, because based on that answer, which is what you said, the body
Uh-huh.
naturally heats up to
Yeah.
basically fight the virus, kill the
Yeah.
bacteria inside the virus, then why ever intervene with that?
I think that's a great question.
Why would you say, well, 102.5, maybe that needed 102.6?
Yeah, right.
So it's the same thing.
It is.
You are doing exactly the same thing at 102.5 as somebody is doing at 1 degree over,
Mhm.
because you're intervening. You
Totally.
don't know when the body beat
Yes.
the virus. So
Mhm.
it's
I think
a
that is
little bit, you have to say. It
absolutely.
doesn't make total logic. Do you just let it go all the way if the body's
Mhm.
so natural and can do this?
Absolutely, and that's fair, and I think that that's where I think my medical background has instigated some fear of
Fine. That's a
knowing
fair
the
answer.
right? Just like if
Yes.
someone looked me in the face and
Yes.
said, "You really need a C-section," what I would do in that situation is I would ask my midwife or whoever, I'd try to get a second opinion. Like I said, I'd call the pediatrician, but if that's something I had to do, I would. And I think that's the benefit of modern medicine. The reason why I say 102.5, 103 is because the science does say that that's when you can have a fever seizure for kids. And then if my daughter has a seizure, then because her temperature got too hot, then what are the repercussions of that? So it's kind of like doing this fine line. And I think we do that all the time, and it's whatever we're comfortable with. And that's a great point. It's more so of just, are we giving the body a chance at all? And I just like to live by, I'm giving the body a chance to hopefully do what it needs to do. And then if not, and I didn't end up giving her anything. She got up to, I think,
Mm,
101.7, and she broke it that night and was totally fine the next day.
wow.
So I never had to give her anything. And so that's the benefit too. But was I monitoring? Was I cautious? And again, I do want to just give background. Like I said, she was acting normal otherwise. If my daughter was super lethargic, wasn't drinking, wasn't having any wet diapers, those are all other things where I'd be like, okay, this is not good. I would have taken her in, you know?
And I think it's important that you're defining where that is, because
Mhm.
the risk of an
Mhm.
episode like this is if you, because
Mhm.
I know nothing pretty much about anything, by the way. I'm just
He
curious.
does.
If people listen to this
Mhm.
and they say, I am convinced that the body can naturally heal in all
Mhm.
these circumstances, they may just let it go to the point where it's dangerous and it does
Mhm.
not self-correct, and they could kill their child.
Yes. Oh, and people have been accused of
You
that.
have to, it's okay,
Yeah.
but at the same time, I do think the best
Yeah.
approach, in my opinion,
Mhm.
there's a balance here.
Yeah.
Yes, the body is amazing, natural fighter
Mhm.
of everything, but I like that you bring in your science, your knowledge of nursing. It
Mhm.
is intervening in your brain.
Yeah.
Whether you like it or not, there's a
Mhm.
point where you're like, I'm not gonna let it go too far.
Totally.
Maybe it's working some, but at some point I'm gonna, and
Exactly.
I think that balance maybe is is a, because I just don't want
Yeah.
anybody to watch this and risk that they could hurt their child.
Oh, yeah, absolutely. And I think that's the whole thing of make sure you're doing your research, guys. Like really read the
Yes.
books on this and read, my best advice for anything medical for yourself or your child is to look at every circumstance. Like I said in the beginning when I was prepping for birth, I was listening to the podcast with the epidural, the hospital births, the C-section births, and the home births because I didn't wanna, one, set myself up for failure where, say, I had to transfer and I had no knowledge of anything, but then once you see the full scope of everything, then you can decide. But I think our medical system drives more instead of educating, we fear. Instill fear. And that is the problem. That's the same as child or not. That's the same with the cholesterol example I gave you. Educating, which doctors are not educated in nutrition. They take one nutrition course all 8 years of medical school. And but we're
But I
not.
wonder if doctors, when you make a statement like
Mhm.
that, would argue with you
Some.
and say, no, no,
Mhm.
no, no. let me tell you how they teach us nutrition. You think it's
Oh, I would love that. If anyone
I
is
don't
listening,
I would like
come
to
on my
know.
podcast because I
Yes.
would love not a debate, but I would love to know that because
Yeah.
firsthand, and I've met really great doctors. I
Yeah.
have, but usually they've learned it similar to me on the side. Like my
Yeah.
nursing degree did
Probably.
not teach me about the Tylenol. I took integrative health coaching and I worked in functional medicine. And that is where I learned, for example, that Tylenol tanks glutathione, and glutathione's an antioxidant that's produced in the liver. And, that's where I learned that stuff. And so there are really great doctors out there as well, but they're usually learning it separately. And that's the whole problem, right? Is it's like, why are we not just sharing what we can do? I can't remember if I shared this in the first part of the episode or not, but one of my big aha moments in nursing school was I was in my pharmacy class, and so that's all meds. And we were learning about SSRIs, so antidepressants and anti-anxiety drugs, and we learned about this herb called St. John's wort. Have you ever heard of it?
I think so.
It's literally like an herb. It's just like rosemary, similar. And the big thing that we learned, this was a defining moment in my life. But I was sitting next to this girl named Stephanie from my class, and my teacher said, when they are on an SSRI, you can't let them take St. John's wort because St. John's wort is a natural antidepressant and you can't take two at the same time. And then Stephanie raised her hand and she said, if St. John's wort's so effective, why don't we put them on that first? And my teacher is amazing. I loved her. And she went, yeah, that's the question. And then that was it. And then we moved on. And this was so eye-opening for me because I'm like, why wouldn't we do that? SSRIs are one of the hardest medications to ever get off of because you become not necessarily dependent, but you have to titrate off of it so carefully when you're with mental health and with emotions. And it has a ton of side effects. All of them have a ton of side effects. And it's just like things like that where, even my teacher, she goes, yeah, that's the question. But there's no further conversation.
Then when you're in nursing school and you're doing it, were you having a lot of doubts while you were in nursing school? Or did it all happen after? Like,
I think there were seeds planted along the
yeah.
way where it was like stuff like that, where I was like, that's interesting. I never thought about that before, And then I wrote about, actually, when I went on my own and started health coaching on my own, I wrote about that story in a blog. And I was like, this is where, because it really was crazy. It's funny what we remember and what we're supposed to remember. But I was like, oh, that's something that's making me, and again, open-minded at the time. I had no idea, but I was just scratching my head and I was like, that's an interesting concept to marinate on.
But they are teaching, and then you can ask me some
Yeah,
questions.
yeah.
But this is the last one because
Okay.
it's so related. The overriding theme, from what I understand, and again,
Mhm.
I'm skillless. I often say that on YouTube. I'm pretty good underwater. That's about it. Okay, let me stay focused, which is a problem. If the overriding theme, definitely in medical school, and I believe it's the same in nursing school, my daughter's a PA. She
Mhm.
heard this theme. My other daughter's an occupational therapist, and she heard this theme, is number one, in every single decision you make as a medical professional, do no harm first. So doing no harm first should mean that you're only turning to a scientific medicine or procedure if, in my mind, the body itself can take cannot take care of it because there are risks. Every bottle of medicine has a label on it
Mm,
of the risk. So if that's taught, if the
mhm.
number one first thing they say is do no harm first, then why in the
Yeah,
world are we very, very much
yeah,
medicated as a society very fast,
yeah.
immediately, frankly? I don't know the answer because I'm guilty of it. I
I
can tell
think
you that right now. I'm
yeah,
guilty of it. I
yeah,
mean, you know,
totally. Your definition is a great definition, but I think if you lined up 12 doctors and said, "What is your definition of do no harm?" Doctors, nurses, PAs, whoever, I think everyone would have a different definition. And I think you can be sincere and you can be sincerely wrong. And with, these doctors. I'm not saying this is malicious or these nurses or whoever, right?
Yeah.
It's how we were taught. I wasn't taught that St. John's wort thing, for example. Would it be unethical for me to tell someone, "Hey, you should take St. John's wort," when I know nothing about it? I'm not that was the extent of my knowledge of it. You know what I mean?
Yeah.
And so then you get into ethics of what's your role. And I think the biggest thing I've learned after being a nurse, being in functional medicine, and also being a health coach is a lot of the times, one, we know exactly what we need to do. For example, your story of, Woody changed his diet a little bit and you cut out sugar.
No sugar espresso,
Yeah.
coffee.
Yeah. Cut out sugar for a little bit, was eating a lot more greens, a lot more fiber, and like saw massive health impacts.
Yeah.
We talked about sleep a little bit with him and I, and
I'm struggling a little with
it's
one
the
of them.
phone. He's addicted to a phone. He's like 17, a
Just
17-year-old.
hard to get away from this thing. Look at it. It's on my lap. Okay,
Yeah.
I'm sorry. Go ahead.
No, you're fine.
It's true what you're
But
saying.
one of the things that I've learned is that, for example, after talking to Woody, I'm like, what do you think? What sounds doable first? And he said no sugar. I never told him no sugar. I'm going to say that. Obviously, you want to watch it. But like he was like, yeah, I'm going to cut out sugar and I'm going to eat more greens and I'm going to do this. And he came to those conclusions. Now, I think they're amazing conclusions. And I think, I don't want to speak for you, but you've said you've seen several benefits.
Definitely.
And
remember I told you about my prostate situation? Remember that thing was way high?
Yeah, PSA. Mm-hmm.
Fly, like I have cancer. That's all that came to my mind.
Mm-hmm.
I can't remember what my number was. Way more than it was supposed to be. I don't know how. I think you cured me of cancer.
You cured yourself, though. That's a thing.
Without any medical intervention, it came down. I did go to the urologist, and they were close. By the way, they were close to wanting to biopsy, which is very invasive, by the way. I've talked to some people that have had it. Yeah. That is not fun. And I got to tell you, it was a PA, and she just said, I don't know what it is about you. I'm not kidding you, but there's something about you. I want to check it one more time. Before we do this, the way you're talking to me, I want to check it one more time. And she's like, it's unbelievable. It's like back down to like a 2.6.
Yeah. After the health changes. And I think that's,
wild. It's not made up.
No. And
Can you believe it? Were you surprised by it?
I wasn't as surprised because I think this is my belief. The body can heal. I didn't heal him. Woody, he didn't heal. He healed himself in a way, but basically what he did is he removed the inflammation and the barriers that were preventing his body from doing it already.
I really think so. I want you guys to hear this because I'm going to share it on Dive Talk. It really did make a huge difference. For me, maybe my body just reacted to, hey, you're putting too much sugar. You're not eating any fruits. You're crushing Burger King and McDonald's. I'm not lying. Yeah. And maybe so. I think so. Not maybe. Yeah. I really believe it. For me, it made a difference.
Absolutely. Well, I think one of the things I love to talk to people about is the compound effect of you don't need to change. Say you're listening to this and you want to really get in shape. You don't need to start having a personal trainer 5 days a week. Like, what can you omit? Take one thing away and then add one thing. So take soda away and then add walking 20 minutes after dinner. You will see effects. I'm not joking. And some people, I think our society doesn't think that's enough. It's like the simple stuff is never enough. And we want it to be almost harder than it needs to be.
And what else is interesting that I have not told you? You actually start to like the stuff that you were avoiding. Literally was like, all right, at the beginning, like I'm gonna force myself to eat an apple. I don't want it because right there is my barbecue potato chips that I'm ready to eat the whole bag, which by the way, when I'd wake up in the morning terribly, because I have to take Nexium. Like I would,
like the reflux?
Bad.
Yeah.
I crave apple.
Yeah.
I crave them now.
Yeah.
Your body, if your mind or something changes to say, you know what?
Oh yeah.
Maybe it said, these are, hey, brain, dumb Woody. it's good for you. So I'm going to make you like it.
Our taste buds will change.
Yes.
For sure. I think it's the same as liking wine. I remember in college, the first time I had wine, I was like, ugh, this is terrible. And now I really like wine. It's same with coffee, right? Everyone, I don't know if multiple people can relate to this, but my experience was like, I started drinking coffee in college. I was not drinking coffee. I was drinking a Frappuccino, whipped cream, chocolate with like 1 ounce of coffee, 90 grams of sugar. And then then you kind of go to like a vanilla latte, then you go to this, and then now I can pretty much drink it black or a splash of cream or something.
Your mom won't, by the way. I don't want to
No,
talk
she
about
won't.
her.
My mom's needs to.
Full-blown vanilla latte, sugar, the whole thing.
Oh yeah, she asks for extra sweet, terrible. But it is interesting because then if I were to go and probably have a Frappuccino or something now, I'd probably get a stomach ache.
Yeah.
Because your body adapts. And this is that intelligence too of our body is adapting to what we want. That's the same thing where when you are in an exercise routine, you start to crave it. You're like, feel stir crazy. Oh, I got to get out. I got to do something because of that. And I think that's great. That's actually dopamine. Those are endorphins and you're ticking so many boxes too. Like a walk outside. I love recommending this to people because again, it is the simplest thing you can do, but walks are lowering your blood sugar, especially if you do it after a meal. That's the best time to walk. Lowering your blood sugar, you're outside, you're getting some sunshine. Hopefully you can do it with a friend or a family member, or you can call someone while you're walking. Like it is just the ultimate habit stack if you create it to be. But we have to make space for this in our days. And going back to that of you don't have to walk for an hour. Do the 15-minute, the 20-minute walk, and you will see the effects compound.
No, but you did say something earlier. So I am guilty of what you said earlier. I can't go all the way to the point that you said, which is all the no vaccines because of fear.
Mm-hmm.
Fear, 100% fear. I'm not trusting it. I'm like, Andy, I hear you, but CVS, I walk into the drugstore, they're like, hey, they keep your data. You need the following 4 shots.
Mm-hmm.
All of them I took, which by the way, felt horrible. Let me just tell you.
I was going to say, weren't you sick after?
Brutal. I'm like, this is the worst. But I was scared. Mm-hmm. So I still... And I know most people are scared. We are definitely scared. I mean, to just say, I'm going to let go, I'm not going to do any of those. I mean, you're talking about stuff that we've eradicated from the face of the earth that we're taught that we eradicated because of vaccines. Polio.
Right.
Measles for the most part. If you don't, and I've just had to get my measles updated. A lot of things. And if I'm worried if I don't do that and I'm wrong, it's worth taking the vaccine. That's the balance, and I can't get past that.
Yeah. Well, and I think this goes back to everyone's threshold. So yeah, if you just to provide context, like we kind of got on this conversation last time, and it's going to be whoever's listening to this, I apologize for the back and forth, but it's going to be good.
It's awesome.
Yeah. But the part about vaccines, and I took them all as a kid. I did. I don't take any now. And I think, again, it goes back to the research. And I think when you look at the insert itself, right? I think I mentioned this last time, but the flu vaccine has only ever been, every year it shows the efficacy and how much it prevented the flu strain that year. And the highest it's ever gotten in the last 30 years is 52%. So when you're thinking about that, like this goes back to doing the research. And I would counter you of how much research have you done on vaccines?
0. When they came out with the COVID, every one of them and boosters.
Yeah. Right.
Now, I still got COVID 4 times because the shot doesn't prevent you from getting COVID.
Right.
It started to be less and less sick over the COVID. It just became like a little cold.
Or was that your natural immune system? Since you had 4
I know.
times.
I'm admitting I don't know.
And some of those, like that question to that of was it the vaccine or was it you having it 4 times that helped mitigate your symptoms? I don't know. Like only God knows that answer. Yeah. Neither Woody or I can answer that. And so I think it goes back, but I do just want to challenge people of read the insert. Like truly, if you want to know exactly what the CDC says, you can literally Google this right now. You can put polio vaccine insert and it will show you the PDF that is put in the packaging when it goes to the pharmacist.
Then how would they have gotten rid of polio?
Well, they would.
Ever. It was all it was
Well, there's
how
thoughts
okay.
on polio
I'm just
of
using that one as an example.
yeah. So for example, if you do look, there's a thought. This is not my thought. This is just something to consider, everyone. But when the vaccine came out, the amount of people that had it was at an all-time low. So it's really interesting too and this is the question, was natural immunity finally catching up at that point? And then it seemed like it was because of the vaccine.
And that is
And
definitely true. You're positive of that fact?
and that's data. Yeah.
Okay.
You can look up there's a graph that I'm picturing in my head. Um and it's just interesting, right? These are just interesting facts of different things and kind of going back to our first conversation of I think it's just amount. Like you said, you got 4 at a time and it took you out. That's a
Brutal.
lot.
I
That's a
went
l
home in my bed. I was goner.
Yeah. And so that's another consideration, right? Like if it's yes, the risk outweighs the benefit to certain extents and all these things, but I would just challenge it's such a emotional response. I think because of COVID was a huge reason, but it's such an emotional response. And if you're listening to this
Yes.
and you feel emotion coming up, I would just challenge you, one, take a breath, but then like look up the insert. This is straight facts from the CDC. It's exactly what you're getting. It's exactly the risk. It's exactly the benefit. It tells you everything. You don't need to Google it. You don't need to go to WebMD. Just go straight to the source and look up what it says. It's like that's my advice always. When people ask me, what are my thoughts on getting this or giving their child this? That's not my call to make. My response every single time is look up the insert and look up what do you feel when you read it and but nobody wants to do it. I'm just going to share that. Nobody wants to read it. Nobody wants to do the research. They just want to be told what to do. And I don't know what that is in our society, but it's like we just want this easy, maybe it's the instant gratification from the phone. We just want it easy peasy, someone else tell me what to do.
I'm
But
about to do that.
what?
This is awesome. I love this. This is great stuff. I'm going to right now,
Okay.
I want to see something.
Yeah.
I'm going to go to ChatGPT
Okay.
and I'm going to say, are we living longer as humans than we were in 1950? And if so, why? I'm going to
Okay.
ask ChatGPT.
Do it. Yeah.
Because if we are, and it says why, I want to know why.
Yeah. If it says vaccines.
If it says medicine in general and technology.
Which I'm sure it will.
Are we living longer now as humans than we were in 1950? And if so, why?
All right. Can't wait. Let's see it.
Yes, on average, humans are living longer than they did in 1950. And we knew that already.
Mhm.
Several factors contribute to this increase in life expectancy.
Okay.
Here they go.
Yeah.
According to
ChatGPT.
data,
Yes.
ChatGPT is just going out and
Totally.
finding information that's on the internet.
Yeah.
Doesn't mean it's right. Number one,
Modern medicine.
medical advances. There have been significant advancements in medical technology and treatments, vaccines, antibiotics, and improved surgical techniques that have all led to better health outcomes. We'll just take one at a time. Improved healthcare access.
Yep.
More people have
That makes
access to
sense.
healthcare. Better nutrition. So that's right up.
That's interesting.
That's right in
Yeah.
your wheelhouse. Public health initiatives, campaigns focused on hygiene, sanitation, and disease preventions have greatly reduced. Like, clean water is
Yeah.
more available in the world. That one makes sense. Lifestyle changes, that's right in your wheelhouse. So that's good. And reduction in child mortality, improved maternal and child health care has resulted in lower infant and child mortality rates, which positively affects average life expectancy. The problem with this, though, is the very first one that comes up, which is the one, if you're like me, your attention span is maybe one line, medical advances, and it goes right to the word vaccines.
And I think there's validity in that too, right? And in terms of all of those listed out, there's so many factors and variables. However, my question now would be since the 2000s, how, then we can go down the rabbit hole of since we've seen the uptick in vaccines, how many more illnesses have we seen? How much more autoimmune? How much more?
Certainly, there is a big question about autistic children.
Yeah.
That's big
And so
one
then we're
that's different.
seeing, is it actually contributing to us living longer, and what's our quality of life? That's another thing. We have, one of my saddest, oh, this was terrible. I was shadowing at Children's. I could not, when I was in nursing school, you shadow everywhere. You have to do clinicals everywhere. And I was so excited for Children's, and I was so excited for the ER. And I will tell you right now, I cried at the ER and I cried at Children's. I'm not meant for that. And there was this little boy, he was probably 11 at the time, and he tried to commit suicide when he was 5. He tried to hang himself from a fan,
Oh my God.
causing severe brain damage. I don't even wanna know how a 5-year-old comes up with
I
that
know.
and what his home situation was. Here's the thing. When I went there, he was 11, okay? So 6 years, and I read all of his background notes. I was heartbroken for this little boy. I mean, he was basically a vegetable. He could kinda smile, but no eye contact, nothing, and he was bedridden, so severe atrophy, very taut, just so sad. His parents hardly visited him in the hospital. They actually had made complaints about it. The only family he had was the nurses, and here's one thought. These advancements did save him. And but he has been in a hospital bed. I honestly hope he's passed at this
Yeah.
point. I really hope he is. I would picture the afterlife is, regardless of your beliefs, is absolutely better than being bedridden in a hospital. And he was there from 5 to 11 in the hospital because of this modern medicine. He had a feeding tube. He had diapers on. He had a catheter. Like, how, granted, that's great. Yeah, he lived longer than he probably would have. And I'm not saying that modern medicine is good and there's so many things, but then at the same time, and again, there's ethics and so many layers to this story.
Yeah.
But I just remember being so heartbroken. We are we are designed for touch, physical touch. And the only touch he was getting, like, he didn't have a mom. He was 5 at the time, 6, 7, 8, 9, 10, and, no one was, like, laying with him in bed, and no one, maybe the nurses were here and there, maybe some occupational therapists, but they're working. They can't just, like, lay with him and watch a movie. Like, there's primitive needs that we have that just are heartbreaking sometimes. And that's a tangent, and again, there's so much to unravel there, but I do just wanna, as a devil's advocate of pointing that out, of, yes, we might live longer, and that's great, but how is the quality of life? And then we do go back to autoimmune, we go back to fertility now. The US current day has one of the worst fertility rates ever in terms of getting pregnant and carrying a full-term pregnancy.
Yep.
And so
Could be microplastics too.
I
Hearing a lot about
yeah.
men that once they eliminate all try to in their
That's
house,
huge.
all of a sudden they're
Yeah. Sperm quality is better,
way
everything.
better.
Yeah. And it's multifaceted. I'm not saying that's vaccines. I'm saying that it's just a lot of, we have just so much in our environment, and it's the phone. I mean, it's everything, really. But I think that that's where everything goes back to the basics of, when you look at the blue zones. Have you heard about the blue zones? It's these pockets of the world. There's tons of documentaries on it if anyone's interested, but it's these pockets of the world where people live the longest without chronic disease.
Oh yeah, I've been to a couple of those places.
Yeah,
One of them's in
Sardinia.
Italy. Yes,
Yeah,
I went and visited them.
yeah.
There's like 85-year-old men that are
But
out working the fields,
yes.
and they eat the most incredible. They
Mhm.
feed you if you
Yeah.
do like a journey
Oh,
there,
cool.
like natural lamb, the best
Yes.
food you ever ate, which was just on their farm.
Mhm.
I wanted to see them.
Yeah.
It's funny you mentioned that one first.
Yeah, there's
Yes,
Sardinia, Italy, somewhere in
maybe in
Japan,
Japan. Yeah.
Costa one, and, a couple of, one is in California, actually, and it's an Amish community, which is super interesting.
But they're
Um,
physical too, so they're getting tons of natural
yes.
exercise.
And the common denominators with the blue zones is they're outside a lot, they're walking
Yes.
a lot. Community was the second
Yes,
finding.
they all eat together.
Yep.
Saw that.
Family dinners.
Amazing.
And that makes sense. I mean, think about solitary confinement as our worst punishment because we are not meant for it,
No,
you know? And yeah, quality of food, of course, you're working, you're active, but there's a lot of things, but
unbelievable. I saw that.
it's,
I saw
I
that.
would
It was
love to go there. That's awesome.
the food that they put out on the table,
Mhm.
it's unbelievable.
Yep.
All farm raised
Yum.
by them, prepared by them, incredible.
Yeah.
And you just can't believe it. I remember we were talking because we were just so curious. during my
Mhm.
crazy adventure days. And we were like, well, how old are you? I thought the guy was
Mhm.
like 30, 40. I don't really, you can't even believe it. He's like,
Yeah,
well, I'm 85.
that's
You're
crazy.
like, he's
Yeah.
shreddville and healthy.
Well, and they have no processed food too, but the food's
No,
delicious. They're still eating like,
incredible. I still crave
cheese
it.
and fruit and meat but it's all fresh
They
over
have no
food.
chance. I mean, we're not, now that I'm saying this,
Mhm.
we're not going to be able to. Here, I'm in Denver right now interviewing with you. I'm not going to be. There is no possibility of living in a community like Sardinia here.
You
Where are you going to buy your groceries, eat,
Yeah.
go eat? But where there's impossible.
Well, they are popping up. It's really interesting of like some of these regenerative neighborhoods. You can Google that, guys, if anyone's interested. Super interesting. But basically, they have community gardens. They have a lot of community event. They're trying to go back to this way, and I think there's a push for that too. People are growing their own gardens, but I also think it's just the small things of like, what are you willing to do? Like one of my goals
Mhm,
this summer is to have a small garden. Will it thrive? I have no idea, but like even just some tomatoes, but maybe it's not that. Maybe you don't want to grow a garden. Maybe it's every Sunday night is family dinner, no phones. You invite your kids over, you guys have family dinner, everyone leaves their phone at the door from 5:30 to 8,
or just
you know?
scuba dive as much as
There you
possible
go. Yeah.
underwater in the ocean.
I
There's a
mean,
lot of science behind that now. I've been saying it for years on
yes.
Dive Talk, and now the science is like, "Oh, there are he's not
Mm,
insane. There are special powers underwater." Let me just
yeah.
tell you a couple.
Yeah, I would love to hear.
This is science. Well, when you're underwater, the partial pressure of your oxygen is automatically higher than what we are here on land.
Mm,
We're at 20.9% oxygen
mhm.
right here at the surface. Well, not in Denver because you're
Yeah.
too high, right? Well, underwater, you have a higher partial pressure of oxygen. They heal the body. There are treatment centers that are oxygen therapy. You're breathing in all that natural bioluminescence underwater. It's ingested into your body.
Mm,
You can see it when you move at night and you
yeah.
move your hands real fast. You can see all that stuff. So
Mm,
all these divers are like, I get this diver's high. I feel so amazing. And they're so energetic. Why? I mean, their
yeah.
special power
I'm gonna learn how to
underwater.
scuba dive.
Oh, yeah,
Every time
it's
I
life
talk to you, I'm
changing.
so inspired.
That's life changing. I
Yeah.
There's stuff I've seen that I've talked about on Dive Talk, and the words just don't really do it justice.
Yeah.
It's way, 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 way more than you're ever going to see.
Mhm.
Life forms, beauty, perfect ecosystems that are in perfect balance, societies underwater that are working naturally and perfectly that you simply I have not been able to witness on land. I mean, maybe there's certain parts of Africa that you could go to and maybe see it, but it's
Yeah.
unbelievable. And the fact of the matter is, the shark is, I believe I'm right on this, I think is the oldest traceback species still to be on Earth today,
Oh, wow. I didn't
right?
know that. Yeah.
And how about the biggest creature ever to exist on Earth? Ever. What do you
Mm.
think it is? Ever in the history of the world?
A whale?
It is the blue whale
Huh.
that is still around today
Have you
that
seen one in person?
I've never seen one in person. I've seen whales underwater, but
Yeah.
not a blue whale. They eat microplankton. They eat the natural stuff that I just talked about
Mm,
that we're breathing in.
and they're massive.
They're 70, 80 feet long.
That's crazy.
They're okay. I mean,
Yeah.
imagine how big that is. And they're the largest animal to this day that ever existed on the face of the earth.
Wow.
The big species that were, they're all gone and extinct because the anyway, there's just a lot behind that. I know we're all over the board. We started with natural childbirth, but it
It's
is
great.
fascinating because it
Yeah.
gets into the topic of natural.
Mhm.
And the most natural, healthy place in the world is underwater. I'm telling
Mm.
you right now,
I need to learn. I do need to
you'll be blown
learn.
away. You could possibly cry if I showed you certain things underwater.
I'm sure. I'm sure there's a whole nother world. We went camping this summer and there's light pollution everywhere. I don't know about you guys or where you're listening in from, but it's so hard to see the stars if you're anywhere urban whatsoever. And my husband and I went camping Crested Butte, Colorado, so 4 hours from Denver. And oh my gosh, at night, it is incredible, you know? I remember catching light I don't even know the last time I saw a lightning bug. But I remember this as a kid and you were out and laying in the stars and just kind of hanging out, bonfire. And we've lost some of that.
I mean, it gets into so many different topics. That light that you're seeing could have taken 10 million light years to even reach you. That was 10 million years ago
Yeah.
at the speed of light. Started travel. So there's we say, well, how are we the only ones in existence of they're moving away at the speed of light. Whatever existence in galaxies that may be out there with light, with life, are moving away from us at the speed of light. We have unless we can warp time, bend it.
Yeah.
Getting in we can't get
Do you
there.
think we can?
I believe eventually I believe that the octopus is an alien creature. Google it, ChatGPT it. Tell me what you can trace that. It has 9 brains. Find its origin. Anybody that wants to put a comment in this that found the origin of the octopus originating from some species here on Earth, educate us because
I've heard so many stories about the octopus. I watched that documentary, one of the documentaries.
That one's the best.
My Friend the Octopus or something.
They're
and I knew nothing
super
before.
intelligent.
Guys, go watch that, by the way. It's on Netflix, I think. But fascinating.
Amazing. What they do underwater, the intelligence. I mean, there's documentaries of octopus. There are a lot of times they're attacked by these little they're called like zebra sharks. They naturally try to eat the octopus. The octopus have learned they just jump on top of them and ride them until they wear that shark out, and then they.
No way.
Yeah, they're brilliant. They're super smart. They get to know you all by feel. They will eventually know you versus somebody else. They're super smart. But anyway,
should we go down a rabbit hole?
We may have already.
Okay, well, one rabbit hole, bridging off the octopus. Everyone stay with us if you want. But one thing recently that I've been wrestling with, so I believe in Jesus and want to model his life. One thing that's really interesting, and this isn't actually just Christianity, but Mohammed, Buddha, all of these major religious figures, the common denominator that's speculated about Jesus, but known about some of them, is that they never ate meat. And it's interesting because going back to the octopus, one thing that I saw that will literally live in my brain forever and I hate, but in Asia, they'll eat the octopus while it's alive. And it's like, I think ethically, like when you're watching this, I'm like,
I won't even consider you one. They're so smart.
Well, so that's the thing, right? And I've just been playing with this on, thou shalt not kill. That's biblical, but that's a commandment. But then you can go to every religion and they have something along those lines. And it's like, should we be eating something that has essence and that had life? And I don't know, this is a tangent, but the octopus is what made me think of it.
The only thing I'm going to chime in on, because I happen to be Jewish. So whatever higher spirit you do believe in, there is tremendous overlap. And in religion, many religions discuss dietary laws of their religion. Judaism, I can tell you that I'm pretty sure I'm right on this, but whatever they define as higher intelligence animals are all not kosher. In the Jewish Bible, they're not kosher just by the mere fact that they're higher intelligence.
Yeah, there's a verse. It's like something with the hooves. It's really specific in the Old Testament.
It's so specific.
Yeah.
And this is scary. Listen to this. Okay. I'm going to blow your mind in a rabbit hole. Listen to this. Let's say, Andy, let's write a religion. We're going to fake it that it came from God. So let's not be too specific because they'll call us out. If we're going to write a religion and you get too specific and they find all these deviations from your specificity, you're done. No, they'll be like, you're full of I'm seeing, okay. In the Torah, which by the way, Christians believe in the Torah.
Yeah.
It's just, they went on. They list the following. And I want to know how a man would have known this. I'm going to give you 2. Tell me how a man would have, tell me how anybody from this planet would have known this. It says every single fish in the ocean that you will ever find that has scales on its body will also always, without deviation, have fins. This was 5,000, whatever thousands of years ago. So let's say I'm in the Keys or in a huge biodiverse area like Indonesia. I'm fishing. I pull up a fish that has scales but doesn't have fins. The religion would be gone.
Right.
Okay. That's one. They've never found a fish that has scales that doesn't also have fins. Okay. That one, yeah, people, well, they could have guessed that one. They fished enough where they figured that one out. Okay. Every animal that rechews its cud will also have split hooves. So every animal, if it's rechewing its cud, its hooves will be split.
Yeah.
They've never found a deviation from that. One more, the last one.
I love it.
Jews have a different calendar. It's a combination of the solar and lunar calendar, and it defines time and months by this combo of the lunar and the solar calendar. Now, the rabbis, when the Hubble telescope was launched, said, a lot of people are challenging our calendar and they don't know if it's really accurate. And we keep saying that this calendar was given to us by God. And if it was given to us by God, it has to be perfection. Yeah. The sun and the moon and the planets have to line up to the 1 gazillionth of a second. And if it doesn't line up to the 1 gazillionth of a second that our calendar says, that it's not given to us by God, then our entire Judaism is thrown out over this fact. So they challenged NASA. The rabbis were like, okay, you go, you got Hubble now and lasers and all that. Because we only back then, if man wrote it, they only had this little thing to look through. And so listen, this is remarkable. If they're still with us, this is the most remarkable thing. Remember when they first launched the Hubble telescope, everything was blurry. Remember that? They had to fix the mirrors. And the rabbis said to NASA, when they first did the Hubble telescope test, NASA said, rabbis, this is really sorry, but it's wrong. It's not lining up like you said. And because you're wondering, well, how did they figure out that the mirrors were off? I don't want to say that the Jews are smart, but just listen. The rabbis said they were so believing in their religion. They said, can you do us one favor? Can you check your mirrors? What?
How would they even know that?
They're just believed in faith.
Wow.
They checked the mirrors. It's fact. This is NASA. And then, because things were blurry as well. They're like, oh my goodness, the mirrors were like 1/1,000,000th of a degree off.
Yeah.
They said, could you redo the test? You know what they came back with? The calendar was within 1/1,000,000th of accuracy. And that's only 1/1,000,000th because they can't get Hubble any more perfect.
Wow. That's crazy.
And the rabbis were like, eventually, you'll have the technology to be as good as our Torah.
That's crazy. I've never heard that story.
That's how perfect.
That's amazing.
Now, there's no way if a man wrote that 5,000, 6,000, 1,000,000 years ago, how is he lining all that up? To 1/1,000,000th of a second?
Yeah.
There's something.
Yeah.
Whatever your religion is, that I don't care about. Come on.
Totally.
Think that they figured that out?
Well,
man wrote a religion that figured that perfection level out?
The most fascinating, which I know we're running out of time and we'll probably have to do
but
another
that's cool,
one.
Right?
It's so cool. Oh, it's so cool. Well, one, I hope this conversation has been super insightful in many ways, but also I love the mirrors of our body reflected in the world. For example, if you look up the lung and the branches of the lung, the medical, depiction of it, and look at how it looks in our body, and then you compare it to a tree, all the branches and its breath. It's such a synchronicity of the leaves. They take in the carbon dioxide, they make it into oxygen, and then the same with our lungs. And there's so many of these that continue over and over and over again, like our fingerprint. How is it that every single person has a different fingerprint? And I love these stories.
Because you are God.
Yeah.
You're created in the image of. Do you think it's random that you have exactly 100% 7 holes in your face, which is exactly the creation of the earth? Everything in the
the
time frames are
numerology
7.
is wild.
to numerology one, you just go to some of those things and you come out with goosebumps.
Yes.
And what's interesting when you go to them, they always say, we're not here to convince you that there's God. We're here to give you data and science. You walk away and make your own conclusion. And I've went to a couple of them and you're just like,
that's crazy.
it's
Wait, I would love to go. I need this information.
It's scary.
Mm-hmm.
The rabbis won't even teach all the Kabbalah stuff because it's secrets of the universe. That it's too much. It's just too much.
Wait, I could talk to you for 3 more hours.
But it definitely, when you go to some of those, they use science and computers to even change one vowel because there's unbelievable amount of codes in the Bible. And then the codes correlate to facts that happen. But if they remove one letter, they cannot regenerate the codes in any form or fashion statistically at all. You will have goosebumps no matter what religion you're in. And it just goes on and on. It's fascinating stuff in the world.
I love it. I love it. Well, okay. Thank you so much for being on. Woody kind of interviewed me for part of this.
I was just curious. It's amazing.
I think we covered so many things. Guys, if comment and let us know. Share with us what's super interesting. What are your thoughts? Obviously, please be kind, but this is just open conversation, and this is why I love interviewing people.
There's going to be a lot that won't be kind. That's okay too.
Yeah, true.
But if you do want to see where God shows off, like really brag it, it's like, oh, God, okay, that's enough.
Yeah,
just go underwater, scuba dive.
All right, that's next on my list. After I have this baby,
then God shows off. I'm like,
come to Florida or somewhere.
Blow your mind.
Oh my gosh, I love it. All right, well, thank you so much.
Bye, everybody.